Well, good afternoon, everyone. Thank you for being here today. I want to thank our hosts very much, Northwell. Michael Dowling, to my left, is head of Northwell. They have done an extraordinary job all through this situation. They have an extraordinary leader in Michael Dowling. Michael Dowling ran healthcare for the state of New York, social services for the state of New York. He worked with my father, came for 1 year, wound up staying with my father for 12 years in state service. So he's one of the really beautiful and brilliant leaders in this state, and it's a pleasure to be with him. And I want to say to all the people of Northwell who've done extraordinary jobs, thank you so much, and thank you for having us today. To my right is Melissa DeRosa. She is the secretary to the governor. To her right is, what's your name, young lady? Mariah Kennedy Cuomo, who is part of my team, and it's a pleasure to have her with me today. I'll be mentioning more about that in a second. Today is Sunday. That is a fact. I know these days tend to run one into the other, but today is Sunday. And I like to focus on the facts in this situation because facts are what's most important. A lot of people have opinions and a lot of theories, but Senator Daniel Patrick Moynihan, who was a great senator from the state of New York, liked to say everyone is entitled to their own opinion, but not his own facts. So let's give the people of the state the updated facts. This is the chart of total hospitalizations. We've been watching this 24 hours a day for, it seems like, most of our lives, but it's only been about 40 days. The total hospitalization rate is down again in the state of New York. We're down to 16,000. If you look at the numbers, we're at 18,000 people hospitalized for a period of time. It flattened there for a while. It paused there. Then it went down to 17,000, but this is a low from our high point of 16,000. Big question of whether we've been past the apex, past the high point. And it turned out the high point wasn't a point, but the high point was a plateau. And we got up to a high point, and then we just stayed at that level for a while. But if the data holds, and if this trend holds, we are past the high point, and all indications at this point are that we are on a descent. Whether or not the descent continues depends on what we do, but right now we are on a descent. And that's in all the numbers. The hospitalization numbers are down. The 3-day average of the hospitalization rate is down. I was speaking to Michael, and that's what he's seeing in his hospital system. That's what emergency rooms across the state are saying, that they see the maximum inflow is less than what it was. So that all tracks with what the numbers are saying. This number of intubations, which I watch carefully because intubations are the number of people put on ventilators, and 80% of the people who are put on ventilators don't make it. So this is a very important chart to look at, and the fact that those numbers are down is very important. This is a reality check. With all the good news and the reductions, we still have 1,300 people that yesterday came in and tested positive and were hospitalized. 1,300 is a lot of people coming into the hospital system with that diagnosis. Less than it had been, so that's good news, but it is still 1,300 people who are testing positive and need hospitalization. We've been watching the spread of the virus from the New York City area, and there have been little outbursts on Long Island and in upstate New York, and we've been jumping on those outbursts, but overall, we have controlled it, and the numbers are about the same. Westchester and Rockland, where we had real problems. Remember, the first problem was in Westchester County, New Rochelle. But Westchester, Rockland, Long Island, upstate New York is still only about 7% of the cases. So we're watching for a potential spread in other parts of the state. But so far, we have contained it, and we have controlled it. Nursing homes are still our number one concern. The nursing home is the optimum feeding ground for this virus. Vulnerable people in a congregate facility, in a congregate setting, where it can just spread like fire through dry grass. We have had really disturbing situations in nursing homes, and we're still most concerned about the nursing homes. The worst news of all for us to live with every day, and an everyday tragedy, we lost another 507 New Yorkers, and those are not just very large numbers we see. That's every number is a face and a family and a brother and a sister and a mother and a father and people who are in pain today and will be in pain for a long period of time. So we remember them in our thoughts and prayers. But on this Sunday, day of reflection, thank you from the bottom of my heart and on behalf of all New Yorkers for what the people at Northwell have done, the entire team. Talk about team effort. This is the team effort. And to all our healthcare workers all across the state, 1 million healthcare workers, 445,000 hospital workers, 160,000 nursing home workers, they have made all the difference in the world. And, a crisis like this, it tends to bring out the best and the worst in people. And certain people can break your heart in their response to this. But on the other hand, other people can rise to the occasion and just give you such a sense of confidence in the human spirit. And the healthcare workers have done that. I've been looking at this chart for 40 days. And it looks like a bar chart. It looks like numbers and a line. I don't see it as a bar chart as we've been going through this. To me, it was a mountain that just kept building and building and building, and you didn't know where the top of the mountain was. And those numbers kept growing, and we kept going up the mountain, and we kept wondering, where is the peak? Where is the apex? What is the high point? When does this stop? And we get to the top of the mountain, and by the way, it's not a point. And then it plateaus, and it plateaus at a very, very high rate, which means every day those healthcare workers have to come in, and they're seeing a tremendous number of people come in the door, overwhelming the capacity of the hospital. And remember, we asked hospitals to increase their capacity 50%. So if a hospital had a 100-bed capacity, now they had a 150-bed capacity. And it stuck at that very high level on that plateau. And that was day after day after day, people who were at their max and had given it all. And then the next day, it's the same thing all over again. But they did it. They got us through the plateau, and now they're getting us down the other side. And we just pray to God that it remains down on the other side. So there's been a lot of pain and a lot of anguish for a lot of people. But the skill, the courage, and the love of our healthcare workers, of our first responders, of our police, of our essential workers, they have really gotten us through all of this. We also want to thank our neighbors, 95,000 medical professionals who agreed to help in this state and outside of this state, who said they would come and help us. And I want to thank the other states and communities who we put out a call for help, and we got help from all across the country. It reminds me in that post 9/11 time when we needed help and other communities in the Northeast needed help, and people came from all across the nation, and they just wanted to help, and they just showed up. That's what happened here. And that, when I talk about seeing the best and the worst of people at a time of crisis, that outpouring of generosity, I'm sure you felt the same, gave us such a sense of confidence that we're not in it alone. And humanity and the love of the American people was there for us. And I said, we need your help today, but New Yorkers also never forget. And thank you for the help, and we will be there when you need us. And we will be there when anyone needs us. Right now, our neighbors in Massachusetts are looking at an increase in cases. I spoke to Governor Charlie Baker yesterday. They may need 400 ventilators, and we know how important ventilators are. If their numbers keep going up and if they have to scramble. And I said, you were there for us, and we're going to be there for you. If they need 400 ventilators, we've already identified them, and we will bring them over on 24 hours notice. And we wish them well, and anything they need, we're going to be there. So the recent news is good. We are on the other side of the plateau, and the numbers are coming down. But that's good news only compared to the terrible news that we were living with, which is that constant increase. And remember, you still have 1,300 people who walked into the hospitals yesterday testing positive. So it's no time to get cocky, and it's no time to get arrogant, right? We still have a long way to go and a lot of work to do. And this virus has been ahead of us every step of the way. We have been playing catch up from day one in this situation. So it is no time to relax. And this is only halftime in this entire situation. We showed that we can control the beast, and when you close down, you can actually slow that infection rate, but it's only halftime. We still have to make sure that we keep that beast under control, we keep that infection rate down, we keep that hospitalization rate down, as we now all get very eager to get on with life and move on. So it's not over. And we have a whole second phase. And in this second phase, first, do no harm. Don't jeopardize what you've already accomplished by seeing that infection rate increase. We have to be smarter, especially when it comes to the new frontier of testing and how we test and how aggressively and how we get that organized. And then when we talk about rebuilding, we have to talk about not just rebuilding, but let's learn from this horrific experience. And let's take these lessons forward, and how do we build back better than before? I don't want to have gone all through this and then just say we're reopening. No. We have to open for a better future than we have ever had. And we have to learn from this. And as we go through this, remember, I know people are eager to get on with life. We have slowed the infection rate down to 0.9%. 0.9% means one person infects 0.9% of a person, less than one. That means the virus is slowing. If one person is infecting 1.2 people, the virus is increasing and is an epidemic and an outbreak and is out of control. So we have a very small margin of error here as we navigate going forward. Any plan that is going to start to reopen the economy has to be based on data, and that means it has to be based on testing. And this is a new world for all of us, testing. How do you get testing up to scale? How do you get it up to scale quickly? And how do you find out where we really are right now in terms of this virus? You have all these scientists and all these experts who are basically trying to extrapolate from the data, but we don't really know. How many people were infected? How many people had coronavirus but self-resolved? We don't really know because we haven't been able to do testing on that large a scale. But we're going to start here in the state of New York with antibody testing. Antibody testing means you test a person to find out if they have the antibodies, which they would have if they were infected with the coronavirus. And we're going to do that in the most aggressive way in the nation, where we're going to sample people in the state, thousands of people in the state, across the state, to find out if they had the antibodies. That will tell us, for the first time, what % of the population actually has had the coronavirus and is now, at least short-term, immune to the virus. This will be the first true snapshot of what we're really dealing with. And we're going to be doing that over the next week, and the New York State Department of Health will be running that. There's also another set of tests which are called diagnostic testing. Diagnostic testing is whether a person is positive or negative. And we're coming up to scale on this, even though it is very, very hard. Northwell is leading the parade on this, and I just looked at some of the technology they're bringing in. All these different manufacturers who made different machines to run different tests. And there's a number of big manufacturers, and Northwell is bringing in as many as they can. But this has to be brought to scale. Nobody has done testing at this level ever. And we have to do this in partnership with the federal government, because there's all sorts of logistical questions and supply chain questions, and people can't get certain chemicals they need to do tests, and the chemicals are made in other countries. So we have to do this with the federal government. I spoke to the head of the CDC yesterday, and he was very smart and very informed, and we talked about how we can do this together. Talk about being smart. The federal government is talking about passing another piece of legislation which would help in the reopening. And they want to help small businesses, and that's great. They also have to help state governments and local governments, which have not been supported in the previous legislation. Everyone is saying, well, it's up to the states to come up with a reopening plan. It's up to the governors, up to the governors. Fine. And that's true and right and legal. But the governors in the states have to have resources. And yes, you have to help small businesses, you have to help the airlines, you have to help all these private sector interests as well as citizens. But if you don't help the state government and local government, then how are we supposed to have the finances to reopen? And if you don't give state and local government support, we're the ones who support the schools, we support the police, we support the fire, we support the hospital workers. We support the transit workers. So if you starve state and local government, all that means is we have to turn around and reduce funding to the people who we are funding. If we don't get federal assistance, you're looking at education cuts of close to 50% in the state of New York, where school districts would only get half of the aid they got from the state last year. You're talking about cuts to hospitals from the state. I mean, how ludicrous would it be to now cut hospital funding from state governments? So the governors, bipartisan, Democrat and Republican, in this crazy political environment where you can't get Democrats and Republicans to agree on anything, all the governors agree and have said to Washington, make sure you fund the states in any next bill you pass, and we asked for $500 billion, again on a nonpartisan basis. We also must remember as we go forward what we have done so well thus far, the mutuality and discipline that we have shown. I have many school districts in the state, over 700 school districts. They're calling, saying they want to open up their local schools. They want to make these decisions. Local officials are calling. We have beaches, we have parks, we have businesses. We want to make decisions. I understand the pressure that the local school districts are under. I understand the pressure that the local officials are under. I understand the mounting political pressure. People see those numbers come down. They're like, okay, let's go. Let me get out of my house. I get it. But we have to stay smart and we have to stay united. Now is no time, as I said, to get arrogant. We're working with our regional states, our partners, New Jersey, Connecticut, et cetera, the surrounding states. We're coordinating with them, and we have to continue to do that. The weather's getting warmer. The numbers are coming down. Cabin fever is getting worse. I believe that's going to be a documented disease when this is over, cabin fever. But we have to stay smart and we have to stay coordinated. We've been working with the New Jersey and Connecticut because whatever one state does affects other states, right? You live in Nassau, you live in Suffolk, you live in New York City. You can get in your car and be in New Jersey. You can be in Connecticut in a matter of minutes. So it's very important to plan accordingly. It's not that we can be on the same page on everything, but at least let's know what each other is doing. So, for example, on state parks, we're coordinating what our policies are because you could see people go from one state to another. I was in Albany yesterday, talked to a couple who drove up from Queens for Thai food to Albany. And I said, you came up for Thai food from Queens. You know, it's a 2.5-hour ride. And they said, yeah, we had to get out of the house. I said, just for Thai food. You know, in Queens, they have Thai food also, very good Thai food. I'm from Queens. But it just shows how people need to get out and do something. So we get it. New York, state parks are open. New Jersey, they're closed. Connecticut, they're open. New York, our beaches are closed. In New Jersey, the state beaches are closed. Some of the local beaches are open. Connecticut, they're open. Connecticut marinas are open, and New Jersey and New York also. So staying coordinated with our partners is very important. And it's important within the state also. I get the political pressure that everybody is under. I get the political pressure that local officials are under. But we have to be smart, and we have to be coordinated. People have to have the best government from government officials in the state of New York. Government matters today in a way it has not mattered in decades. And it's important that government sends the right signal and one message, and there's no confusion. Because if people don't have confidence in government right now, if they think there's chaos or confusion or politics, that would be a terrible message to send. We've done a great job as government officials, all of us, Democrat, Republican, state, local. We have to keep doing it. And now is not the time to send mixed messages. And also on a very parochial level, I get that in the conversations I've had, people feel political pressure. Here's the simple answer. The state's emergency powers now govern in this emergency. Blame me. Blame me. Somebody's complaining about a beach. Somebody's complaining about whatever. Businesses open, schools open. Blame me. It's true. It's right. It's the state law. And I don't have any issue with that. So blame me. Also, as we're planning the reopening, let's set the bar a little higher. And let's all start to think about this now. What did we learn during this? Personally, what did we learn? Socially, what did we learn? Collectively, what did we learn? And how do we incorporate that into our reopening, right? How do we have a better healthcare system when we reopen? How do we have a better transportation system, better telecommuting, a smarter telemedicine program, better technology in education? How do we have more social equity? You can see the disparate effect of this disease and how it reinforced the disparity and inequity in society. How do we remedy that? And are we more cohesive as a community for having gone through this, right? So it's not just reopen. It's not just build back. It's advance. Use this as a moment in time where they look back when they write the history books and they say, boy, they went through a terrible time, but they actually learned from it, and they improved from it, and they moved forward. We had 9/11. Yes, we built back. We built back different. We built back smarter. We had Hurricane Sandy, devastated Long Island. I was governor. I didn't say we want to replace. I said we're going to learn how to do a new grid system. We're going to learn how to do better infrastructure. And we did. Long Island today is better for having gone through Hurricane Sandy, as terrible as that was. We have to do the same thing here. How do we come back even better? So the long and the short of it is, thank you to all New Yorkers for all the good work, to our healthcare workers, a special thank you to the police, to fire, to the transit workers. The economy has not been closed down, right? All the essential services have still been functioning. You still could go to a grocery store and get food. Lord knows you could go to a healthcare institution and get health care. The transportation worked, the buses worked, all these people who kept everything working. We thank them from the bottom of our hearts. But also remember, we still have more to do. And New Yorkers know that, because New Yorkers are tough, but tough doesn't mean just tough. Tough is easy. It's tough but smart, but disciplined, but unified, and but loving. And that's who we are as New Yorkers. Last point, on a personal point, I have my daughter Mariah, who is with me, and she is the third daughter for me. And she just came home, if you will. She was quarantined, so now I have all three daughters with me. And they can't appreciate this, but it's such a comfort to me personally to have them home. When your child is not at home, especially at a difficult time like this, you're always wondering, where are they? Are they okay? Are they doing what's right? And every instinct is you want to be able to protect them. And when they're not there, you have this constant hole in your heart, right? And this constant question as you're going through the day. So you're trying to do everything that you have to do, but you still have this question in the back of your mind, where's Mariah? How's she? So that they are now all three with me gives me a great sense of comfort. And in this crazy situation we're in, but for the craziness, I would never have my three daughters with me again. They're 25, 22 years old. The last thing they want to do is hang out with Pop, right? They have places to go, people to see, they're taking life by the horns. So I get this beautiful silver lining in the midst of this hell, where my daughters are with me again. And we get to celebrate family, and we get to bring back traditions, and we get to enjoy each other and have really in-depth conversations that we even haven't had in years, right? And reconnect in a way we haven't had the opportunity in years. Today is Sunday, and I come from an Italian-American household where we had a great tradition on Sundays. The family had to come together at the table. You had to be there. They called it dinner, but it started at 2 o'clock in the afternoon. It was somewhere I don't really know why they called it dinner, but everybody was at the table. Spaghetti and meatballs every Sunday. I started my tomato sauce before I left. We're going to go back. We're going to sit at the table, have our spaghetti and meatballs on Sunday, and I know what I'm going to talk to them about. My daughters, Mariah, and Mariah brought her boyfriend, who's also here. The boyfriend is very nice, and we like the boyfriend. Advice to fathers. The answer on what you think of the boyfriend is always, I like the boyfriend, always. Because there's only two options. Either you like the boyfriend, in which case you say, I like the boyfriend, or you don't like the boyfriend. But you can never say you don't like the boyfriend. I learned this lesson the hard way. Otherwise, it triggers NDS. NDS is natural defiance syndrome. It's not documented, but it is a psychological condition where if you say as a father, I don't like him, natural defiance syndrome kicks in, and then they like the boyfriend more because he is opposed by the father. So the answer has to be, I like the boyfriend. In this case, I actually like the boyfriend. But even if you don't like the boyfriend, the answer can only be that I like the boyfriend. But we're going to be at dinner with the boyfriend, and we're going to have our spaghetti and our meatballs. They won't eat the spaghetti and the meatballs because when I cook it, they just won't eat it. But they move it around the dish, and that's all I can ask. But I'm going to tell them, I'm going to recall to them how important that meal was on Sundays, to have the family together, to take the time to sit and to talk and to reconnect. People talk about the Italians and they love the food. Yeah, they love the food, but the food was just a magnet to get the family to the table, right? It was just the device to get people to spend 2 hours at the table. And that's where you talked and you went through the week. And I used to do it at my grandfather's house. My father, mother, my kids, all the siblings would go to my grandfather's house. My grandfather's name was Andrea. I'm named for him, Andrew. And at the end of the meal, my grandfather would always say, he was at the head of the table, and he would say, okay, that was my vacation. And then he would get up and they would do whatever they were doing. I never really understood what he meant. And later in life, I said to my father, who was his son, I said, what did Grandpa mean? That was my vacation. He said, well, your grandfather never had a day off. Your grandfather worked 7 days a week. He ran a little grocery store, delicatessen in Jamaica. And he worked 7 days a week. And he was saying that was his vacation. He never took a vacation. And everybody would take a vacation on TV in the TV commercials. That was his vacation. The 3 hours at the table for dinner with his family, that was his vacation. And then he would go back to run the store. You think of how our immigrants work in this country, and wherever the immigrants are from, what that whole immigrant philosophy and drive does for us. And I'll end where I started. You think of all the essential workers, well, we had to stay at home. I'm tired of staying at home. Yeah, think of all the people, all the essential workers who had to go out there every day and work in the middle of this, who frankly would have much rather stay home. And they didn't know what the virus was, and they're out there working with the public, exposing themselves. Why do we have a higher rate of infection among African Americans, Latinos, et cetera? Well, who are the essential workers? We have a higher rate of infection among the essential workers because they were out there driving the buses, and they were out there driving the trains, and they were out there running the hospitals and the emergency rooms and the nurses and the police officers. They didn't get to stay home. And they got sicker and they died more than anyone else because they were there honoring their responsibility to their job and to public service. And let's remember that, and let's remember them. Yeah, we're all going through a tough time, and it is a tough time. But a lot of people have shown a lot of courage and a lot of beauty, and they've had very tough lives, and let's appreciate them at the same time.